Hi, and welcome to another edition of the Rotator Cuff Expert. I'm Dr. Daniel Orcutt, and today we're going to talk about incision care after surgery. So when we have surgery, whether it's open surgery or arthroscopic surgery, we're going to have incisions, we're going to have wounds to take care of. And so the general idea of this is to protect the wounds so we don't get an infection afterwards, and we try to minimize the scarring and improve the look of the incisions afterwards. So the few things to think about, like where are the incisions? And so if we look at the rotator cuff, when you do rotator cuff repair, we're gonna expect to have some incisions in the front here. So this is probably the most important incision, I'll tell you why in a minute. And there's probably gonna be one on top. This is usually where we put the little anchor in. And this is one on the side, and this is where we actually use the camera to look at. There's gonna be one on the back as well. But the one that I think is most bothersome for people, especially for women, is right here in the front. Because the front, this is kind of right where the bra strap goes by. That can actually hypertrophy the scar or make the scar bigger and redder and more painful. So there are a few things we can do to minimize that, but we'll talk about the scar in just a minute. So right now we're just talking about the post-operative care, more immediate post-operative care. So what you're gonna come home with, you're gonna come home with a big bulky dressing. And typically, the big bulky dressing will be on there for 2 or 3 days. Depending on your surgeon, depending on what you had done, what kind of incisions you have. So make sure before you leave the surgery center or the hospital that you know exactly what you're supposed to do with the big bulky dressing. And after you take the big bulky dressing off, you know exactly what you're supposed to do after that. So I'll tell you the generalized idea, but obviously talking to your surgeon and the post-operative nurses will be the best way to find out, to make sure you're doing what you're supposed to do to protect the incision, protect the wound, and hopefully get the best looking and feeling scars after surgery. So if we do an arthroscopic procedure, right? So we do the arthroscopic with little incisions. So typically there's 2 ways to close those incisions. So depending on who you are, you may close them with nylon, which is a permanent stitch, kind of what you might typically expect to see after having a cut or something like that. The nylon's a permanent stitch, which means they have to be taken out, and they'll probably look like a little black thing tied up, and you'll see it and you'll know that. So the nylon's a little bit different, and monocryl is another way to do it. Monocryl is actually a absorbable stitch, so it'll absorb on its own over time. So my personal preference is the absorbable stitch. That way we don't take the stitches out. It doesn't bother the patient. So typically what you'd see in my situation with my patients would be you have this incision with little clear looking suture and it almost looks like fishing line, and then a couple steri strips, or what we call butterflies, over them. And that's what we're gonna keep on them for a long term, for 10 days, 14 days, however long it takes for them to actually fall off. That's what I would use, whether they're bigger incisions or smaller incisions. The difference is if they have a bigger incision, we may want you to wait before you get it wet. And so my typical time frame is if it's just the little incisions, we can get those wet in 2 days. If it's a bigger incision, we'll make 3 days to let that seal up a little bit. And so after surgery, the general idea is take that big bulk dressing off in 2 or 3 days. At least that's what I say. Talk to your doctor. 2 or 3 days. And then what you do, then you put the little Band-Aids over. So I would like a waterproof Band-Aid over these incisions, and then I'll let you shower. All right, so the waterproof Band-Aids are on, probably for the first 10 days or so, until the incision begins to look more like a scar and less like an incision. And so this is where it's crucial, or it can be important for this incision on the front. Again, this is really what's more aggravating. It's right here. It may be from a t-shirt, maybe from a bra strap, and it just can get really irritated. So sometimes what I would recommend is you get a little silicone patch or pad. It's clear and it's a little thickening. And then once it looks like a scar and not a scab, you can put one over the top of that. You can put them on all of them, but the one over the top of the one in the front, because that's the one that's most irritating. So that's one thing you do. The second thing you can do is if you do have a scar that seems to be hypertrophying, getting a little thick, what people call it keloiding, then you can take Mederma or vitamin E oil once it looks like a scar, not before that, and you just kind of rub that scar, do a scar massage, you call that, trying to smooth off, break up those scar tissue underneath. Again, this is usually the one that's most irritating. The other ones are less likely so, but you can use them on all of them, and that often will help break down the scar and have a nice, better functioning, feeling scar. Showering, again, 2 to 3 days, depending on what you have had done and what your surgeon's preference is. And then the silicone patch, the scar massage. And people might say, well, what about antibiotic ointment? Do I need that? Should I use that? And typically my answer is no. I say no because If we have a little bit of fluid that wants to leak out of the shoulder, I'd rather just leak out of the shoulder. I don't want it to stay in the shoulder. So we know when we do the shoulder arthroscopy, we blow up the shoulder with a saline to allow us to see what we're doing, allow us to minimize the amount of blood in our field. And so the fluid goes into the shoulder and then goes out the little holes in the shoulder. And so we know that some of that fluid is going to stay in there for a while and slowly leak out. And we just want it to be able to leak out. We don't want to seal it in there with antibiotic ointment. So probably not the antibiotic ointment. We talked about using the silicone, we talked about using the vitamin E oil, and also the thing called Mederma. Mederma is a kind of scar thinning ointment you can put on there. You can try that as well. But I guess the biggest thing is, a couple days, 2 or 3 days after that, you can take everything off. You can put the Band-Aids on to have a shower. And then if you're not showering, you can just have those little steri strips on there. That's fine. We're not gonna have any issues. But if you see anything red, or at least it's draining stuff that's not clear, that looks more like thicker fluid, then certainly talk to your doctor. Let them know. We wanna know sooner than later if we're having wound issues. The only other thing is the bigger incisions, right? The bigger incision needs a bigger Band-Aid. But the same applies. You're gonna have if you have a big incision in the front, you're gonna have those steries across. And so it just takes a little bit longer for that to heal. We wanna protect that with the Band-Aids as well during the shower. I hope that helps. If you liked the video, please press like. We would love you to subscribe and let us know how we're doing. Let us know if there's any other questions, any other things that come to mind that you'd like to know after surgery. Please let me know and I will do a video on it. Thanks so much. Have a good day.